All right, welcome to the Crushing the Preclinical Years section of the How to Study in Med School free course. This section is on immunology. So the outline of this immunology lecture is why immunology sucks, why it is and is not important, how to study immunology, and then some great resources for it. So why does immunology suck? All right, immunology has a ton of detail, almost too much detail for medical school. Right, there's so much to learn in medical school, and when you get into a topic like immunology, you start to get kind of stuck in the weeds of all the details and whatnot. And you really don't need to know all of it, right? We're not all going to be immunologists. It's fantastic information, but you really don't have to know all of it to be a good doctor, to score good on the boards, and ultimately to pass med school and get in residency. So when it comes to boards, mentioning that they are very superficial with the knowledge of immunology. They really talk about like CD targets. They talk about receptor targets. They maybe the white blood cell extravasation, that type of stuff. They don't really go into detail of where the T cells are born, where the B cells are born, how they mature, those types of things. Um, they just don't do that. And so the boards are very superficial with their knowledge of immunology. And once again, it's pretty cool to know, but clinically, it's not always necessary, right? I didn't spend a ton of time on immunology. I did great on the boards. I matched my #1 program, and I like to think that I'm a pretty good doctor at this point in time in residency. There's still a lot to learn, but I like to think I'm pretty good, and I didn't put a ton of effort into immunology. So why is immunology important? Okay, so this class ultimately helps you to understand basic immunity. And then it helps you to know the future of medicine, biologics. So basic immunity is nice to know. It's nice to know so you can explain to your patients how an immune response takes place, right? Especially with vaccines and things like that. It's nice to be able to talk to them about how this happens and why they should get their vaccines, and those kinds of things. And then for the future of medicine, in referencing biologics, really we're seeing so much growth in this field of medicine. The biological medicines like the monoclonal antibodies and things coming out and being fantastic treatments for things like autoimmune disease, infections, and whatnot. And so, having a basic understanding of immunology will help you understand where things are going with these medicines that are likely going to be the medicines that treat a lot of things in the future. So why it isn't important, okay? It's just too much detail. And then all the details don't really help when practicing medicine. Right, so it's fantastic to know every little step of a process in the body in terms of an immune response, but does that really help you practice medicine? Not always. Not really. If you understand kind of the basic steps, and then you'll understand what medicines do because they interact with those basic steps, then that's enough to understand the treatment, to explain it to the patient, and to know what the outcome is going to be. Okay, it really doesn't help you a ton with clinical medicine. So how do you study immunology in an efficient way? I like to break it up into different immune responses. Okay, you break it up into the innate and the humoral immune response, and if you know those two things, if you know the basics of that, then that's fantastic. Okay, after you know those things, the things for boards will be memorizing CD markers, CD 21, 15, that kind of stuff, and other similar markers. Okay, and then know how white blood cells leave the vascular system. That's very popular for testing. So these two up here are very helpful for clinical life, for life as a medicine, or for life as a doctor, and those types of things, right? If you understand those two and you can break those up, then you understand what a lot of biologics, you can explain why people should get vaccinated, that kind of stuff. That's very fantastic. That's great for clinical knowledge. For testing, the CD markers and white blood cell extravasation is important. So if you know the CD markers, you'll get a bunch of questions right. If you know how white blood cells leave the blood vessels, then great, you're going to get a ton of questions right. CD markers and white blood cells leaving vessels doesn't really help you a ton in clinical world, but that's great. Those are great topics for tests. So great resources here. Okay, how the immune system works. This is a very small book that is a very quick read, and I would highly recommend you get it. Then obviously Boards and Beyond and First Aid are always recommended. But Individualized to Immunology, How the Immune System Works is a fantastic book. So, kind of in conclusion, immunology is not very fun. It's kind of a giant pain for a lot of students. If you break it up into those few things that we talked about, right, the innate, the humoral, CD markers, and then white blood cell extravasation, you will at least have a basic understanding of the things you have to. And then the understanding of innate and humoral responses will help you clinically. All the other stuff, not a whole lot, but it's great. It's great information to have. It makes you look super smart. So, all right, thanks for watching. We'll see you in the next video.